Hello, 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 and welcome. Hey, 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 this is your girl, Dr. T, and I'm coming to you and I'm bringing what? The Eye Doctor's Corner. I told you guys September was going to be a change. So, yes, we are still having the support of Sustain Your Business Academy. But today I wanted to bring to you a new platform called the iDoc Corner because that's what your girl does. That's what your girl does. Listen to me. I'm so hyped. This is what I do. All day, every day, I see eyes. And I think it's important for me to kind of use what I do and just share with you some important key elements. And one of the things I want to talk about today is the fact that red eyes, and we are in the midst of an allergic time. So fall comes in and you have the allergic conjunctivitis, and then you also have the viral component. Now, why is this important? It's important for you to understand that whenever you have a red eye, please, please do not try to treat yourself, especially during this time. So how can I talk about this? I have been an optometrist for over 22 years. I practice medical optometry, and I see children all the way up to 106. Actually, my oldest patient is, I think, 106 right now, because I also provide mobile eye care services. We have an optical boutique. And now we are shifting things a little bit to be able to also treat virtually and provide telehealth care for you if you're in the state of Pennsylvania, or anyone else that's living in the state of Pennsylvania. So I'm excited to bring about what key things you need to look at for redness. So number one, if you've never had a red eye before, think of it as something that you need to look and get treated. Because if you've never had a red eye before, you need to go and look treated. Okay, you need to go and get treated. Then the other piece is if you, have any issues related to allergies, you definitely want to be sure that, you're getting that treated. So you don't want to mix up the two between viral and allergic. And now that we are in COVID-19, there has been an uptick in the viral component as it relates to conjunctivitis, and it has been seen in when you're taking the swabs. It has been seen. So give me a moment. So yes, it has been seen. So we want you to make sure that you're noticing the differences. So number one, if your eyes are red, try not to treat yourself. Go seek an eye care professional. A lot of things have been converted to telehealth, so you can also be seen virtually and still be treated. Okay. And one of the platforms that I'm using is called Eye Care Live. So you can go on there and get the app, and you can schedule your virtual appointment with me. The other piece of that is that you don't want to just use Visine or any other remedy that gets the red out, because it masks the situation when you are being seen by an eye care professional. So you definitely want to make sure that as soon as you see yourself as with a red eye, you want to make sure that you get an appointment to be seen by an eye care professional. And why do I say eye care professional? Nothing negates your primary care practice or practitioner, but they went to school for primary care, not eye care. Now they can definitely prescribe some medication, but sometimes those medications are not what you need. And if they prescribe the medication before we see you and we need to swab or take a culture, we will not be able to because you already began treatment. So you definitely want to be sure that if you are having a red eye, that you just go and get an eye exam and get that treated. And that will be under your medical and not your routine. I always tell patients that all the time. So it will be under your medical and not your routine. So there is a difference between an allergic and a viral. So your viral is contagious. So you need to also explain what other symptoms you are having. So for example, if you are having symptoms of a fever or chills or just a lot of fatigue, that may be the viral component, and you definitely want to be sure that you mention that to the doctor. Okay. So you definitely want to make sure that you are seeing an eye care professional. So there's a difference between the viral component and the allergic component. Now, the allergic component, you'll have a little bit more watering. You'll have some itchiness, okay? And you may even have the sneezing effect. So that's why you want to be sure that you are seeking an eye care professional, because we can always swab or just look at your symptoms to determine whether or not it is a viral component or an allergic component, okay? And so again, that viral component is contagious, and you will have to be quarantined or stay away or really take some rigorous care so that you're not spreading. If you saw on my live before, you would see that I posted about a young man who basically the eyes were so beet red that you know that it was a viral component. So that's the other case to viral, that pretty much your eyes are going to be very, very red, and it's going to be both. You may have some pain, you may have some mucus discharge and things of that nature. So you want to be sure you get those eyes checked out by an eye care professional and do not put anything in them. Now, when I say do not put anything in them, I know I have some old school patients that they actually go and they get the boric acid and they put that in. This may work in this instance if it's a viral, but again, you will be impeding the process for us to determine what the virus is and how we can treat you. So number one, make sure if you've never had a red eye, and we're in this season, if you've never had a red eye, do not self-treat. Go and get your eyes examined by an eye care professional. That would be an ophthalmologist or optometrist like myself, to be sure that you're not having the allergic versus the viral component. And again, the viral component will come with other symptoms like fatigue, a high temperature, or just a malaise that you just really don't feel like you're moving. That would be more of your viral component. Your allergy component, you'll probably still have some itching, some watery eyes. Now, in the viral, you also may have watery eyes, but you get a different sense, and the viral may come on stronger and more powerful, and the redness will be worse. So for example, if you can see this, like your eye can be as red as this, right? So you definitely want to make sure that you seek out an eye care professional. And again, a lot of we're moving toward the telehealth or the telemedicine platform. And so you may want to seek out an optometrist like myself who practices medical optometry versus your just a routine eye care. There is a difference. I specialize in the medical part, and I see all ages. So it's important for you to make sure that you distinguish whether or not that eye care professional is going to be able to treat you virtually, especially in these times. So that's why we've set up a platform where we can treat you virtually if in fact you're having any ocular findings or ocular problems, and we can see you there and treat you there. Okay. So number one, do not self-treat. Number two, if you've never had a red eye before and even not even allergies, you definitely want to make sure that you seek out an eye care professional. Number three, I'm not saying not to go to your primary care physician. What I am saying is that they are primary care, and that's what they do. So yes, they can treat you, but with that follow-up care with an eye doctor, if we ever had to swab your eye, we will not be able to get a good result because you had already started treatment. So you definitely want to be sure that you are getting the things that you need. Now, the only thing that I would use as the final treatment for either an allergy or a viral, because the allergic response or the inflammatory response is going to be in both. So a nice cool compress will work to soothe your eyes in both cases. Okay, so that way you'll have some relief and you will be able to kind of soothe your eyes. The other thing will be an over-the-counter moisture drop, but I would be very, very cautious with putting anything else in your eye before seeing an eye care professional. So again, we are moving into the fall. So there are some things called the fall allergies. You have your spring allergy and you also have fall allergies. So you want to be sure that you're not getting a viral component or an allergic component. And the only way to really find that out is to seek out an eye care professional. Okay. So this is your girl, Dr. TOD. I want you to be safe in this time. I want you to understand that whenever there is redness, that is a key for problems, and you want to seek out an eye care professional. Okay. You don't want to self-treat. I know we're using Google University and we're using other platforms to be able to find out what's going on. The best way to find out what's going on is to seek out an eye care professional. And sometimes when you're doing that Google University searching, you can really put yourself up and even scare yourself even more. So I really recommend that if you're having any redness, any irritation during this time, that you definitely seek out an eye care professional. And even if they say that they can't treat you, they can, triage you over the phone just to kind of see whether or not you need to actually go to the emergency room, or you can come into their office. Or like myself, I'm doing more of the telehealth or the telemedicine. The app is iCare Live. And all you have to do is look up to my name and you will be able to find us. I can only treat you if you live in the state of Pennsylvania. I would not be able to treat you if you lived in another state. However, if you sign up for that platform, I can direct you to a doctor that's in your state. Okay. So I just want you to be very cautious during this time, especially with COVID-19, which is a viral component, which there is an uptick in finding out that there is that there is a viral component to the COVID-19 virus, and you want to be very, very careful. So I'm always telling patients, wash your hands, mask up, put it over here. Okay. And again, if you really want to take some caution, take some more, be more cautious, you can get some just safety goggles for yourself. But I wouldn't say to wear them all the time. I would say that if you feel like you're in an environment where you're more at risk, then you may want to wear some safety goggles as well, and make sure that they are done by a verifiable optometrist, or ophthalmologist. Don't just go fly by night, go into some of these websites. You want to make sure that you have ophthalmic quality safety glasses, depending on the areas that you work in. So if you're in a higher risk population, your job may already be providing those. If not, there are other resources for you out here. But I definitely wanted to just hop on here today and talk to you guys about the importance of not self-treating, the importance of making sure that you know the difference between the viral and the allergic conjunctivitis. The viral you can spread, okay? And again, COVID-19, there has been an uptick in the redness. And when I say redness, I want to say redness like here, okay? Can you see that? Redness, I had to find something there. So very, very red, very deep red. And because it has an inflammatory response, a nice cool compress will work if you want to get some relief and some other things, but definitely talk to your primary care doctor. I would say don't self-treat. If your primary care doctor is versed on viral medication, then that would be something to do. But the most important thing is to get your eye swabbed so we can take a culture to make sure that it has a viral component. And the one thing to note, if you are seeing it in the eyes, lastly, it can last in your eyes for over 14 days. Okay, so it can last in the eyes for over 14 days. So it might behoove you to really see an eye care professional that has the ability to swab, because even after we treat you, we will want to keep swabbing, not on an everyday basis, but to swab after treatment to make sure that you're all clear. So you guys got that? What's number one? Don't self-treat. Number two, seek an eye care professional. Number three, cool compress. Number four, when in doubt, check it out. Go to 911 or what have you, but don't self-treat. Get in there and know the difference between a viral and the allergic component. Okay, so this is your girl, Dr. TOD. I told you that September was going to shift. We are still doing Sustain Your Business Academy, but I wanted to bring this to you because I think this is what I do. I've been doing it for 22 years, and I wanted to be able to make sure that everyone has knowledge about the importance of eye care, as well as the importance of what sustainable health. So this is your girl, Dr. TOD. I am so excited about the Eye Doctor's Corner and look for it probably about once or twice a week. I might come up with some stuff, but if you don't catch me, I know next week we'll be talking about some back to school stuff and some things that you need to watch out with your kids and even for yourself as you are working from home. So thank you for watching. I don't know if anybody said anything, but if this added value to you today, type value. If you are watching this on a replay, put hashtag replay. And thank you for following me. I will definitely post some other things. We will probably transfer some things over to the Academy. I'm working on setting up a page where it will be kind of like a membership base. It's a free membership for you to kind of learn a little bit more about your eyes and have some things up there for you. So thank you again for watching. Again, if this has added value into your life, if you've learned anything about the difference between a viral conjunctivitis and allergic conjunctivitis, just put C in there, or VC for viral conjunctivitis and AC for allergic conjunctivitis, because a lot of times people don't know the difference. And a lot of times, this last thing, a lot of times people think that it is viral and it's allergic, and then they tell you can't go to school and all that stuff. Well, now a lot of schools have been shut down. So this kind of makes it easier for, hey, Ashley, it kind of make things easier for you to work in that. Okay. So again, thank you for watching. I will look forward to seeing you next week. Tomorrow, I will be coming on with Sustain Your Biz Academy. Saturday will be your 8 a.m. coffee with me. And go in and to our event at Med Is My Biz. We're having a women empowerment series, but check everything out We are moving, we are moving, we are moving for you, to empower families, to get you to connect with you, to make sure that you are healthy, wealthy, and wise. This is your girl, Dr. TLD. I'll see y'all on the other side. Be blessed.